And now let's talk matters health. Now, tobacco use remains a major concern in Kenya, contributing to approximately 12,000 deaths annually, according to the Ministry of Health. While progress has been made in tobacco control, emerging nicotine products billed as cigarettes of the 21st century provide new challenges that experts say require stronger action. This week on Health Digest, Gloria Milimu interrogates the Tobacco Control Amendment Bill 2024 and why it continues to elicit mixed reactions despite the government banking on it to protect the young and impressionable youth who continue to view the use of electronic nicotine delivery systems like vapes, e-cigarettes and nicotine pouches, among others, as an attractive proposition. Take a look.
Smoking rates in Kenya remain worryingly high, with approximately 8.5% of the population between the age of 15 and 65 said to be using tobacco. Across the country, such exclusive zones where smokers huddle to quench their thirst for the soothing but lethal puff are a common scene. But while traditional cigarette smoking levels have plummeted in Kenya, experts fear that gains made in combating nicotine use could be eroded by a new trend that is gaining popularity, especially among the youth: the use of electronic nicotine delivery systems. They come in forms of sleek devices which go by different names like jewels, vapes, mods, nicotine pouches, among others. These devices are winning more converts every day, and the quickly disappearing vapor they produce is seemingly not blowing away in the wind soon. The products are here and are now being billed as cigarettes of the 21st century, masked in flavors and packaged in a way that makes them more appealing and socially acceptable. The products are worryingly creating a new generation of nicotine users.
Kama mumeonyeshwa ile tobacco iko siku hizi, hiyo kwanza inakuja kama kalamu. Hata mtoto wako wa 15 years hauwezi ukajua ni tobacco amebeba, kwa sababu hutawahi muona na kiberiti, hutawahi muona akiwasha, hutawahi muona akivuta, lakini hiyo kalamu akiwekelea kwa mdomo ni kama trailer.
While the government of Kenya has put in place tobacco control measures, including the Tobacco Control Act of 2007, experts see the country's laws have to some extent failed to keep pace with the rapidly evolving nicotine products. However, the race to curtail the addiction masked in flavors has begun, and now the Ministry of Health hopes to win this war through stricter regulations proposed in the Tobacco Control Amendment Bill of 2024.
Kitu ya kwanza, kama mtu anataka kulete tobacco na hizo masigara kutoka nchi ya mbali, kwanza utest na hao watu wa huko. Usilete ukisema only to be sold in Kenya.
It seeks to amend the Tobacco Control Act of 2007 to make further provisions on the regulations of smoking, production, and sale of tobacco products, including electronic nicotine delivery systems.
Kama ya ukweli unataka kulete hiyo sigara kuiuza hapa Kenya, lazima uandike maandishi hapo kwa Kiswahili na Kizungu na uweke picha hapo, uonyeshane madhara ya hiyo sigara.
Among the key provisions in the amendment bill are restrictions on flavoring that appeal to children. It limits nicotine concentrations to at least 10 milligrams per milliliter. It also imposes restrictions on advertising and recommends child-resistant packaging. The new proposals that are now with the National Assembly's Health Committee and are set to undergo public participation also prohibits the sale of tobacco and nicotine products within 100 meters of schools and other institutions serving children, among other proposals.
Hii maduka inawekwa karibu na mashule yenye inauza pombe haramu, sigara haramu, na zinauzwa kama mti hivi, 1 stick. Hizo DCC, tafadhali, you know it is by law, they are not supposed to be near schools.
On the other hand, retailers complain that the proposed amendments introduce additional licensing requirements, higher compliance costs, and new layers of bureaucracies that will disproportionately burden them.
As business owners and traders, we are not opposed to regulation. We support laws that protect public health and promote responsible business practices. However, we reject any process that seeks to make decisions on our behalf without listening to our voices.
While these products have over the years been pushed as a safer alternative to smoking, health experts and several studies reveal that there is more harm caused by them than previously thought.
So it can affect the brains of growing up people and children as well. And it has other effects like on the cardiovascular system. The lungs are the worst hit, and the entire breathing tract. So the cells, they get an insult. It makes them behave differently. They release chemicals that cause damage to the airways of the lungs, the airways in the lungs and the lung tissue. So people can get lots of different diseases, including chronic obstructive pulmonary disease or COPD.
They also warn that the economic cost of smoking in Kenya is at least 45.4 billion shillings. This includes direct costs related to healthcare expenditures and direct costs related to lost productivity caused by illness and premature death. Annually, tobacco use causes at least 12,000 deaths in Kenya, according to the Ministry of Health. Many Kenyans who use these devices do so in the false belief that they are a safe alternative to smoking. But science now tells a different story. Gloria Milimu, KTN.